I'm Dr. Devani. I've been practicing for 22, 23 years now. Class 2s in general are the toughest thing that dentists have to deal with. They're the hardest thing, in my opinion. And that's because getting that contact just perfect is really a pain in the neck sometimes. When I first graduated, there were no sectional matrix systems. It was only the Tofflemire, so that's all we had. So I started using a Tofflemire, and I went to a group practice where the doctors were using Tofflemires. And so I kept using a Tofflemire until about 4 years ago. The biggest problem with using a Tofflemire, and I used it for about 15, 16 years, is that getting a nice broad contact was always really tough. You get a pin contact, and that's one of the inefficiencies of a Tofflemire band, is that you get just a little pin contact, and a lot of times that just wasn't enough. And patients would complain about food getting impacted, the floss would go right through, and a lot of times you spend redoing those restorations and trying to get a broader contact. And so there's a lot of time, and it became very inefficient. So, so what happened then is I just had a reawakening one day, and I said, there's got to be a better way now of doing this, because I've been doing this for God knows how many years, and I see these sectional matrices, being advertised, and so I started thinking about that. And lo and behold, my Triodent rep came in, and I discussed with her about their system, and she explained to me the benefits of their system and how far more efficient it was than using my old technology, which is the Tofflemire. And I took a chance. I took a leap of faith, and I took a chance, and I haven't looked back since. Yeah, it's a completely different system, but I think Triodent, to their credit, has made the system very streamlined. It's a no-brainer. There is a learning curve, and I think it's about a day. If you do 2 to 3 to 4 restorations, I think that's all you need. So, and I do 3 or 4 a day as it is now. So and I do multiple, I do quadrant dentistry, so I do back-to-back a lot of times, and it's made it so much more efficient. I get good contacts every time. Polishing is easy. The matrices are sectional matrices. They're shaped, they have different sizes if you're working on a premolar or a molar, so you just pick out, and some of them are even color-coded, so you know exactly which tooth to put the matrix on. The V-rings, which is the actual brain of this whole system, fit perfectly around the teeth, and you get a perfect seal. The main thing is that you have to make sure that the V-ring and the matrix form a nice curve on the adjacent tooth. As long as you've got that, it's a no-brainer. You'll get an ideal contact, broad contact all the time. The other thing I like is that the way the matrices are curved at the top, you can actually get a great marginal ridge from this. So you don't even have to build your own marginal ridge. It's already there once you take the matrix off. The other thing I like is that they have a wedge system, and I think it's called the wave wedge, which is very kind to the gums. It doesn't, with the wooden wedges that I used to use with the Tofflemires, every time you would take that wedge out, the whole area would just bleed. These wedges, they kind of tuck, the way they're designed is they kind of hold the tissue down while they go in, and there's no bleeding. So you take the wedge out, there's no bleeding, you can polish up, it's really easy. And that's coming from a guy that used Tofflemire for many years. The Triodent system is very efficient. It's, like I said before, it's a no-brainer. You know exactly what band to use when you're using a premolar, what band to use when you're doing a molar, what ring to use when you're doing a premolar or a molar. My assistants know what to do. It's a very easy system to use. It's very quick to use. It's very quick to put on and very quick to take off. And I don't have to worry about, is this contact going to be open? Is this marginal ridge very thin, and is it going to break on the patient when they're eating something? So I don't have those worries anymore. And now I can do 2 or 3 back-to-back class 2 restorations in a short amount of time, a lot shorter than before, because I don't have to do a lot of polishing and adjusting either, because the way the matrix system is designed, I get my marginal ridge and everything when I'm done. So there's very little finishing and polishing that I end up doing afterwards. So it saves me time. So it saves me time. I'm more efficient. And I don't remember even one patient coming back and saying that they have an open contact since using this system. And I used to get, complaints with the Tofflemire. which I basically haven't had since using this system. We want to provide the best service for our patients. That's front and foremost of everything that we do. We don't want headaches. We don't want problems for them, for our patients. And you gotta kind of stay up with the curve. And I think practicing with a Tofflemire in 2017 is kind of behind the curve in most cases. You definitely need a sectional matrix system, I think, for better contacts. If you're depending on a Tofflemire for all your cases to get a contact, I think you're failing the patient, honestly. That's just my personal opinion. And I think you're practicing behind the curve. And if you want to do what's best for your patient, I think it's well worth to invest the time in a system like the Triodent.